We're going to talk about a case where some people might say this isn't a veneer case. She's ground down a lot of tooth. She has dark teeth. I'm wearing an appropriate t-shirt that resembles wearing the same color palette as her original teeth. But we're not going to go too white. We're going to keep it in the realm of a natural smile, really exuding health and confidence is what we're going to get into. So if we break down this case and we're analyzing it, we're looking at it, and I said why this might not be a traditional veneer case. Some people might say, look at these crazed lines, you have to have crowns on them. These, there's decay here. She's ground down her teeth really flat, a lot of discoloration. And you can just tell these are flat across those habits. So education is critically important in this case. I speak about wearing a retainer afterwards, complications, possibilities of fracture. Patients know this, right? We talk about these different things and they understand what can happen. And so on a case like this, you can see, if we zoom in, you can see these abfractions right over here. These lines down the middle. Doesn't concern me. This case is 3 years post-op. I'll show you the after photos, and the integrity of the teeth still remains because form follows function. And if you're able to create canine guidance, which is moving the canines left and right, and so that disoccludes all of the front teeth. If you're able to create proper function of the anterior, the front, look at this abfraction, right? You'd think like, wow, how much of this tooth do you need to shave? Not that much. The patient did a lot of the shaving for me. So these are the temporaries. We created shapes that are individual. We wanted to maintain a little step between the canine, created some dominance again here, evening out those front teeth so that they're not staggered, and giving canines the shape so that as she moves and laterally she's able to get where we need to. And these are those flat across teeth that I was talking about, that overjet. So I want to now create form here that differentiates and creates individuality. And these are the temporaries, right? We're still creating textures in the teeth. We're creating forms that look like natural teeth. Even though they're longer, it doesn't mean she's going to be fracturing them. In fact, I believe that that'll help in the disocclusion of her teeth and allow for movement of those teeth as we analyze this side of it as well. Same exact thing. We like that individuality. We like the length between the front a little bit more dominant, and then the laterals are a little shorter. And then following, going along the lower lip architecture, as I've always speak about. This is the porcelain work. We can look at this color. So up top it is a creamy color. In the body there's still a little bit of that brightness, but still creamy. And then some really nice characteristics of a natural tooth at the edges with this staining here and translucency all around. We can see that the preparations, some areas where she had decay or old restorations, crowns, 3/4 veneers. I didn't have to do traditional crowns, right? Full coverage crowns would require me to be shaving 360 degrees around. I don't think that that creates strength in the tooth. In fact, I believe a crown on the front tooth, if not necessary, makes the tooth weaker. On the bottom, these are more traditional veneer preparations, and then obviously onlay veneers and crowns where need to be. This is where we started. Remember those abfractions, those crazed lines, everything flat across. And we jump into a smile that is broad, that creates individuality of her teeth, not weakening the tooth structure, in fact, creating supported porcelain that is adhered to the tooth, flat across teeth that now have individuality in architecture and nice beautiful teardrop shapes, nice form to those front teeth, and a smile that is confident, that is probably created anti-aging by, I would say, 15 to 20 years. You look at her and you're like, wow, you look amazing, as opposed to what she originally had, which was worn, old-looking teeth that make her look older and more worn. And so the teeth are a major component to looking and vibrant and youthful. Aside from having healthier teeth now, better function, she now has a gorgeous, beautiful smile that she flashes around in Paris.